My name is Alex Casella. My training path has been starting in medical school at Florida Atlantic University in Boca Raton. And I actually stayed there and did my general surgery training in the same location. So I was there for another 6 years. After graduating general surgery, I was very fortunate to match into a colorectal surgery fellowship with the University of Texas at Houston. I spent a year there doing my colorectal surgery fellowship. My interest in medicine started really a long time ago. Originally with my family, my grandmother had some health issues that actually eventually led me to colorectal surgery specifically. But that's really when it began. And I would say it solidified in college when I was really enjoying my basic science classes, enjoying my anatomy, physiology classes, decided that medicine was definitely the way that I wanted to go. And then eventually into med school and went a little crazy and decided to go into surgery. And here we are. My relationship with my grandmother had a ton to do with A, deciding to go into medicine in general, and B, how I approach every kind of interaction that I have with patients. She was a Crohn's disease patient. I think it always gives you a unique perspective when you have seen things from the other side of the table. You have been in the patient's shoes. You've had a family member there. I think it informs the way that you want to be as a physician, and it gives you a lot more empathy than you might have otherwise just from having experienced it. So my philosophy with patient interactions is pretty simple, actually. You treat people the way that you want to be treated. When you're going to see a physician, you're going there because you want help. You want help with something. You either want help with prevention of disease, you want help with treatment of disease. But you're going and you're asking somebody to kind of be in your corner. And that's the idea that you have to have when you're seeing somebody, whether you're seeing them for the first time or the 100th time. The patient has to feel like you're there for them because that's your entire job. And if you're missing that, then you're missing the point of why you did this in the first place. What I'm really passionate about in terms of prioritizing the care of my patients is screening and early prevention. I really want to try to get rid of some of the stigma around colon cancer screening and try to bring that to the forefront of people's minds the same way that people have done excellently in terms of breast cancer, mammograms, etc. Collaboration with other healthcare professionals is absolutely paramount, not only in surgery, but in all of medicine. Without having those other providers closely involved with the care of your patients, it's really going to be substandard care. No man is an island, and you really need to have a collaborative team approach to provide excellent patient care. Outside of medicine, I play guitar, both acoustic and electric. I'm a PADI certified scuba diver, certified night diver, wreck diver, and play a little bit of ultimate frisbee from my days in college and high school. And then I'm also black belt in Okinawan Shoryu Karate and Shotokan Karate.